So then what is the possible advantages of superior smoke capture? Effective smoke capture obviously can prevent aerosolization of bacteria. As you know, we currently try very hard to prevent the bacteria from remaining in the operating room by chemical means, and now more commonly by ultraviolet light exposure. This would be a preventative measure rather than a curative measure. And it also has the potential to reduce simulated wound contamination. There have been no studies that I know of using smoke evacuation to date to see what effect it would have on reducing surgical site infection rates. So, kind of in summary, why do we need to solve the problem of surgical plume? The obvious one is what we know already, that surgical plume contains chemicals that are both mutagenic and carcinogenic. We also know that they contain live viruses and bacteria, and that live viruses, especially HPV, have been known now to be associated with adenocarcinoma of the nasopharynx, and in increasing amounts, so that this is not an anecdotal problem. This is a commonly associated problem when there is exposure by the surgeons, especially to HPV through venereal wart fulguration. As well as the next topic that we want to talk about, and that is diseases caused by nanoparticles and the fact that your surgical masks do not offer protection against inhalation of those nanoparticles. We've already mentioned that 80% of surgical plume is, or rather are, nanoparticles. We've mentioned that they undergo macrophage phagocytosis when they enter into the alveoli and become part of the phlegm that is removed by a process known as mucociliary elevator that carries it up and out of your respiratory tree into your GI tract, where all these materials are eliminated. The problem is that the smallest of these nanoparticles, especially the 20 to 80 nanometer sizes, can cross the alveoli when they're present in high enough concentrations. The process is called translocation, and then enter into the circulatory system and the lymphatic system, and then they go throughout the body. What diseases do they cause? Well, this is a list of not everyone, but these are the majority of the diseases that chronic inhalation of nanoparticles are associated with. They include neurodegenerative diseases such as Alzheimer's disease and Parkinsonism, various autoimmune diseases such as collagen disease, lupus erythematosus, and rheumatoid arthritis, various respiratory and distant cancers, especially breast, pancreatic, and prostate cancer, arteriosclerosis, cardiac arrhythmias. Perhaps some of you know of other employees, colleagues in the operating room who have undergone endocardial ablation because of cardiac arrhythmias. This is one of the things which chronic inhalation of nanoparticles is associated with, as well as coronary artery disease.